It's very important to our patients that they feel listened to. I think it's not uncommon for them to have the experience where they might go somewhere and feel unheard or unrecognized. I feel very proud of the fact that when we hear what they have to tell us, we hear that they say that they feel listened to. So healthcare home means to me a place where anyone can come, that we are accepting and that we're understanding and that we're sensitive to people's needs and to reach people and engage them in the things that they need in order to improve their overall health.
I have been an alcoholic and an addict since I was 12 years old. So that's half a century. So I had lost my job with the ferry system, where I had all that great insurance, and now I found myself on Social Security, barely making it. I didn't have any friends at the time. I'd kind of driven everybody away. As an alcoholic and an addict, caring for other people was not part of the equation. The only thing that matters is me, in a very selfish way. I was completely lost. I was lost in my addiction. I was lost in life. I was looking for a place to go.
I've known Paul for a few years now, and when I met him, he was a few years into sobriety. Me and him really focused on managing mood, supporting that sobriety, exploring in an ongoing way what else he might need.
With my bipolar issues, sometimes I have ups and downs. But when I'm depressed, it's hard to feel good about myself. I had to look at my life and decide, was I going to continue to be a victim? And I just decided that the past is gone.
It feels amazing to be a part of this, to be able to provide ongoing care to people who may not have access to it otherwise, to be witness to people's difficult stories, and to also give them a place where we can express full understanding for them. This is the meat of my work. This is where I really feel like good things are happening.
At the 45th Street Clinic, when I go in to see either Laura or Jessica or Sandrine, it may be a 10-minute appointment, it may be an hour-long appointment. But I never felt like I was being pushed away. When I was 350 pounds, orthopedic surgeon at Swedish said, you're gonna have to have both of your knees replaced. And I came in and I talked to Sandrine about it, and she said, make sure that surgery is your last and final option. She said, try losing some weight. And sure enough, over a period of about 2 years, I got to the point where it's a little bit painful to walk, but I still got factory installed equipment. My healthcare team is working for me in a way that provides me with peace of mind and a sense of security. And now I care for myself. Still go to groups every week. I still go to meetings every week. And I've got a group of people that I call to get support.
It's important for people to be able to come somewhere where they trust people with their hearts and the most personal, private things that they're sharing. And we need places where people feel safe to do that.
Every community is healthier because it has access and support around its healthcare needs. All of the underlying, whether it be economics, whether it be education, healthcare is a social good that supports the health of a community.
Neighborcare Health provides empathy and compassion, which is what I did not experience on the outside. I have a family doctor, I have a therapist, I have a nutritionist, and I have a social worker. But the one thing I will say about Neighborcare Health and all the people I deal with is they were never judgmental. I've overcome addiction to alcohol, I've overcome addiction to opiates. I'm just so grateful to be alive.